Our third topic is feline stress reduction techniques in a veterinary setting. So this is especially useful for you guys. So I'll give you 5 tips to reduce feline stress in your practice. The first thing I think we might need to think about is agency. So what is agency? Agency is the perception of control. It's the perception you have that you can influence what happens to you. It's the perception that you have control over your environment. And so that's incredibly important, both in our lives and our cat's life also, because when we feel like we can affect our outcomes through our behavior, we feel empowered, we feel we have control. And so it's essential to a good emotional state, because if you feel like you don't have control over what's happening in your life, you're going more towards depression and learned helplessness. And so that's important for our cats too. And so why am I talking about agency? Well, these pictures are from are AI generated, and you can see that there's something going on with the tail here. But nevertheless, they illustrate what I want to talk about pretty well. Let's say that you're going for a blood draw for yourself, and the nurse tells you you're going to put on those skates and we're going to go do that blood draw on the ice skating rink. That wouldn't be really fun, right? Especially if you've never used a pair of skate, or like it's been a long time. I mean, you don't want to be on a surface that you don't control, where you're sliding everywhere during a blood draw. And unfortunately, that's sometimes what we ask of cats. So sometimes people won't have a non-slip surface between the stainless steel table and the comfortable towel or blanket or bathroom rug that they're using. And so that means that the second the cat puts its paws and it needs to just shift its weight, the towel is going to slide right away on the stainless steel table, and the cat feels a complete loss of control. And so this perception of control is really important. You don't want to be sliding all over the place, feeling like you're losing balance suddenly. And so we have options, very simple options for that. So yoga mats, Canadian Tire has some that are $10, and you can cut them up. The best thing, as far as I'm concerned, is silicone baking sheets. Canadian Tire has these, but honestly, the ones on Amazon are much, much larger. They're a bit more pricier than yoga mats, but still, I mean, they're super easy to disinfect. They're really slick, really wonderful, really easy to move around, and they're really, really non-slip. You have the puzzle squares, but again, not as good. They might do the job between the towel and the puzzle square, but they're not going to do as good a job maybe between the table and the square of puzzle. But these are things you can do so that when your patient puts their paw on your table, they feel secure. They feel in control of their movement. They're not suddenly sliding away, losing their footing, and freaking out. So that's tip number 1. Number 2, we're going to look at sound and visual masking. So by reducing the intensity of an experience, we can reduce the difficulty of facing it. And so if we think about sound, well, we can use calm music to sort of cover the other sounds that are happening, so sound masking. We can use a fan, like those big rectangular fans that sit on the ground. They make a pretty big noise, and so that can cover a lot of the barking dogs, the people talking, the cage sounds, all these things, and can help cats to be able to calm down and perhaps even sleep through the night. And we can use brown noise. We've heard a lot about white noise. My understanding is that brown noise covers a wider spectrum, and so it's better as a sound masking. And so you can use apps for this. You can use YouTube videos to cover the sound. You can also use visual masking. So visual masking is about animals feeling less exposed, because then it's less stressful for them. So there is an article that was made a long time ago by this university. I'm going to put the link in the course. It's for partial cage covers, which are these nice little fabric things on the picture on the right. They're really cute. They're meant for areas of a shelter where cats are adopted. You don't need to make them so complicated if you don't need it to to be. If you look at the two pictures on the right, the person is there in both of them. I'm standing on the same spot. You can see my legs on the one on the right. And this picture is taken from the perspective of a cat who's hiding at the back of a cage. And you can see right away that on the picture on the left, we feel really exposed, whereas the picture on the right, we feel a bit more hidden, and so people might not even notice us. And this doesn't prevent you from taking a quick peek at the cat, seeing if they're okay, but it does really diminish the sense of being exposed that cat has. And so it gives them a better feeling of controlling how evident they are, if you will. You can use fleece, which is the bottom picture, blue fleece. This you can buy by the meter, and so then you can cut it up in the sizes that you need. It really dries quickly in the dryer, so this is something that might be useful. Those clips are not necessarily the best thing because they're metal on metal, but you might use instead the rings, the plastic rings for shower curtains that you might find at the dollar store. That might be more helpful. It depends really on the kind of cages you have. So you can use carabiners, but maybe more noisy. Another thing you can do if you really need to watch a cat that's fearful and you want to provide more cover is you can use cameras. So I like the Yi 1080, but Wise has really upped their game with their version 4. So if you buy a Wise version 4, the sound seems to be much better, which was an issue. The image is really excellent even in darkness, and it has a base that's a magnet, so that might make it easier to just attach to a cage to observe a cat. And so they're not very expensive, so that might give you a way to be able to check on the cat regularly if you have a phone that's dedicated to that. And another way to think about visual masking is during things such as blood draws, some cats really do better if they can hide under a towel. For jugular blood draws, my cat Leah does better if I have a small towel over her head so she can hide. When we don't do that, the vet has a really hard time. She tells me like all the arteries are really like stuck and really tense. So thinking about this, do you need to see the head of the cat, or can he hide while you do a blood draw or a nail trim or take temperature? Sometimes just that visual stimuli is just too much for them, and sometimes we can help them with that. Now we're going to food. I know we've talked about food in all the other sessions, but it is such a great tool to have. We've talked about it last time. We need to pay attention to reverse conditioning when we use treats. So we want to make sure that there's a really, really good food after the procedure has ended, so that we make sure that the association is, well, I was eating, this was a bit annoying, but after it got really good. So like in the end, it was quite okay. I've been asked, like, cats that have food allergies, what can I do with those? Like, can I get treats that are going to be easy to dispense in a cool flow, like the shuru tubes? Well, you always have the options that we've talked about in other talks of making the kibble into a powder, into a Ziploc bag with a bit of water to make a paste and then cut the end. But that still does have the same taste. You can ask yourself, which allergies does this cat have? Because maybe there are things that they could eat that wouldn't be a problem. And some of the things that I've been thinking about with cats that have food allergies are anything that's a fatty substance, such as olive oil, margarine, etc. Or nutritional yeast, which is something that's used in kibble to make the kibble more palatable. And so we're going to see examples of that. Again, I'm not saying we should use a huge amount of margarine. I don't want to make them sick. But there are ways when we can use that to our advantage. So this is margarine in a Ziploc bag, and I'm orienting Miley as if I wanted to do a blood draw. Same thing here with olive oil, and I can orient the syringe differently so that it drops more quickly or more slowly. And this is nutritional yeast made into a powder, made into a paste, and put on a spoon. And again, we can orient the cat in different ways using this. So these are things that might feel new to the cat because he doesn't have these very often, but they don't have maybe the allergens that normally are a problem for them. Now, handling. We know that with cats and with most species, less is best. So in 2022, we had the AAFP ISFM cat guidelines for handling that came out, and that really, let's say, set the record straight for some of the handling techniques that are not considered appropriate anymore. And I mean, it's always difficult to say, okay, I want to change what I do, because we are so used to doing things the way that we've always done them. But the more we develop the skills, naturally, the more we become comfortable, and they become like something that's really easy to do. So taking the plunge is really worth it in the end. Just like we wouldn't ask employees to place themselves in a way that they get irradiated every time there's an x-ray, we're not going to ask them to try to do things in a way that they risk getting bitten. And so less is more. We might say, oh, but they're less restrained. Well, actually, you can restrain them in an appropriate manner that's not excessive, but also the less restraint you use, the less the cat is likely to escalate. And so an escalating cat is more likely to scratch or bite you. So when we go to heavier restraint, right away, you saw it in the video on the last Lunch and Learn, right away the cat's behavior goes, whoa, escalating, I don't know what's happening. And so that's what we want to avoid. And I'm not going to pretend to be perfect on this, but there are so many good videos out there to help you work with that. Also, we want to realize that when an animal is escalating, we're not going to ask people to put themselves on the cat and put themselves in jeopardy at getting bitten or scratched. We're going to go, okay, this is time for sedation. And I know not everyone's comfortable with this, which is why I make it a point to always say fear-free. And their program has a lot of information on what medications you can use at what doses. And also the Facebook group is really active. So if you have questions, it's a good place to ask. And so if you're wondering, well, where can I get this information to integrate this better in my practice, this is a place where you might want to go, because I'm certainly not a vet, so this is not my expertise. I think we're gonna go... well, actually, one great place to go see is Feline Healthy Aging Clinic from the UK. They are a research institute, and so they had research ethical limitations. They couldn't stress out cats, and they've developed wonderful ways to get blood draws on grumpy kitties, on kitties that wiggle a lot, where they practically don't restrain the cat at all, and their videos are really cool. You can, I also refer to them on the website that I'll show you later on. So that's a really great place to go see what other people are doing. This is my cat Millowman at the vet, so minimal restraint. I think that was a little bit cold. He's like, whoa, that's not super fun. I'm gonna distract him with food. You're gonna see him stop a little bit when the poke happens, but then he starts eating again, so he's distracted but feeling good. There's really limited restraint here, and it doesn't last for super long because Millowman is comfortable and the tech and the vet are doing an awesome job. So that's the stop. But then he's like, oh, it's okay. And we've actually practiced this at home also, which helps. But just by minimizing restraint and having a cat that's really comfortable and stable on their paws, we have something that works really well. I think it's 2 years ago when we went with Miley. Unfortunately, I don't have this on camera, but initially I think they sort of positioned him with their hands like we saw the other day, and they tried to start blood draw. Didn't go well. With cats, we have the 2 seconds to try rules, so he wiggled more than 2 seconds, so we stopped, and I said, just, okay, everyone take your hands off. They were like, maybe we're gonna have to do it in another way than the juggler. I was like, just take your hands off. And then I lured Miley into a sit with the food, kept feeding, said to the tech, you can add restraint, which she did beautifully and not excessively. And I said to the vet, okay, give it a go. And I kept feeding him, and it worked beautifully. I think the difference was, he didn't feel like turned around and sat with hands all over himself to make him move. He felt more comfortable with the control he had in the first phase of positioning. Then we added hands, but he'd had all this time to put himself in place without hands, which was easier. He had the distraction, and then we could start again. So it was just beautiful. And also the fact that we listened. So he started to wiggle, saying like, this isn't, I'm not comfortable. We listened and we stopped and we removed our hands. That is extremely powerful because it tells the animal, should you feel a need to tell us to stop, we will. And once we know that, whoa, okay, shoulders can drop. I don't know if cats' shoulders drop, but like it's okay, they did stop. And so it's less of an imposition. It's less difficult for them the second time. So we can adapt. This is Miley getting a cysto, eating all the way. Some people even do it standing. I have, I think, 6 videos from all over the world about this on the website. So we don't necessarily need to have them rolling on their back where they're super stressed. Miley is pretty relaxed here and the eating all throughout. And so if you tell me I can't do this with every cat, well, there are a lot of cats you can. So like start with those, the easier ones, and we can always move to other cats as we improve our skills in the end. So here I'm gonna use my hands a lot to position and everything, and he's like, this is annoying, ears back, and like, no, not super fun. And then of course I don't have 3 hands, so the next clip I'm gonna miss having 1 hand, but it's just to show you how just through feeding you can get a cat in a good position. And then I can play guitar, practicing the things you guys do typically. And I'm gonna mess up here, and ooh, I'm getting a cat that lifts. So positioning of the treat tube is actually a skill to learn, and I'm not pretending I'm perfect at it. You can use the food to bring the nose up, down, forward, backwards. And if you mess it up like I did here, you end up with a cat who gets his paws up. Here I'm gonna finally have the right thing, the right elevation and everything, and he puts his paws down. And then I can play guitar on the cat. I know this is not exactly what you guys do. He finds it a little too much there because you don't necessarily go as high and do what I do. And here I'm just gonna orient Middleman with the treat. This might actually be the video I was referring to earlier, so it wasn't last session, it's this one. And so I oriented and had Middleman sit only with the treats in the end. And so there's a lot less handling in that. And then I can again play guitar, so I could get a blood draw more easily using that, just because I didn't use my hands to position where he's like, why am I getting moved physically? So that can be really helpful. So this is the website I've been talking about. You have under medical care, you have the blood draws, you have the cystocentesis, you have a lot of stuff. It's just a repertoire. I'm just collecting and listing videos from everywhere on the internet from different people. I'm just linking to them. I'm not stealing them, so that you can have it all in one place. So my goal is both for people in the veterinary field and also people who want to train their cat, want to know what does a blood draw look like. I also have a tab about trick training. And so there's a bit of behavior mod in there under practical training. There's daily care, such as brushing. So this is valuable for you and for your clients. If you're thinking, I've never seen someone do a standing cysto, well, there's a couple of people who have videos on the internet and you have them all here, so you don't have to search for too long. I thank you for your attention. I'll put a lot of links in the course in case you want to go see those. And hopefully I've given you some tiny things you might want to try if they weren't already things that you're doing. I'll see you for the next Lunch and Learned.